look like you want to be here, not like you don't. Fine. So I'm not going to make a big deal out of this. What would I like to see? If I ask someone to move their pelvis, what would I like to see? I would like to see that they move that area of their body. Very, very simply. About as simple as it gets. We do know that sometimes people with back pain, they do move. There's some work by Laird. They move their pelvis. They don't move their pelvises as much. They don't move their pelvises as variably, and they move their pelvises slower. All of that stuff seems to be indicative of a bit more of a stiff behaviour rather than a relaxed behaviour. Again, this is just population data. Your individual patient is going to fit somewhere in there. With any movement, could any movement have an association with pain? Any movement, couldn't it? And that's the problem. We try to objectify it. This is the problem. So, again, it could be a trigger. It could be something that's we just don't know. All right? So, again, I think it's about breaking those habits and behaviours. It might be that this be a start, and then I might want to focus on getting someone getting up and down in a different way, in a less stiff way, in a more variable way, relaxing and getting into it. But all I really want to see here, I want to see Jamie move his lumbar spine, and I would like to see him do it with the least amount of effort. I want to see freedom, I want to see flow. I want it to be, in fact, we could say, I want you to stop when it gets hard and it fatigues. Yeah, absolutely. That could completely be the case. So I just want to see, does it? How much does he move? Is that important? Maybe. How much is he meant to move it? I really don't know how much it's meant to be. I will be honest, if I ask him to move his lumbar spine, what would I like him to move? His lumbar spine. Do we always see that?
No.
No, sometimes, when people have changes in body awareness and, is that relevant? Again, it might be relevant for him, it might not be relevant for someone else. So let me get him to move his pelvis, okay, up and down, and go again. What do you think? Does that look pretty good to you? He's moving. Not very harsh.
Oh, I am.
Yeah. But generally, I think we can be a little harsh with people sometimes. For me, that seems like that's pretty reasonable.
Not wagging.
Could I get him to take his legs back a little bit?
Yes.
Take your legs back a little bit, buddy. Take your knees a little bit wider. And relax your shoulders a little bit, and then we might get him to do it again, and we see he gets a little bit more, just because he was a bit tight and bunched up, wasn't he? But what I'm really looking for is I'm looking for it to be effortless, really. Again, sometimes I might put my hand under here. What I want to see if someone's holding their stomach, and I might use a cue of going fat, so I ask someone just to let it all hang out, and then see again if that affects that freedom. Could it be that someone just needs to move that bit of their body? That they don't move it a lot. They just need some more movement input. I don't know. I'm just thinking of reasons. It could be a million reasons why it works. It could be a million reasons why it doesn't. So, what's the opposite of that? That might be relaxation, mightn't it? What would be the opposite of that? I could stick. We could. I don't want to stick anyone. But I want him. How might we increase instability? How might we increase stiffness? I gave you the answer. Instability, right? So it might be that because people love to do all these Superman-y type of things. What does that do? Stiffens people up. You alter stability. We often stiffen in response to that, don't we? So it might be if you had an unstable shoulder, introducing instability might create more muscle stiffness. That could be positive or negative. Give me some Superman action. Go on. Only with the exercise. I don't use the fly.
I would.
So go right leg, left, and there you can see it happen straight away. So get him to come in. I might say relax, and then give me a little wiggle. I mean up, forward and backwards. My instructions are particularly poor there, and Jamie didn't help me out in any way at all. So again, this is about as hands-on as I generally get. Could I get in there and give him a little bit of a guide if I wanted him to go a little bit further? So the idea might be you're not moving him, you're facilitating, it's guiding. And I do quite a lot of that. Again, could I get him to move his body in some different ways? So I could get him to come back, and that might flex his body, his spine. Could I also get that to come over to one cue might be take the... You could take this to the ankle, like that. Good, and then we could go the other way. That's something that I might work on with SI joint stuff. Just providing a little side-to-side stimulus can be helpful. Could I get him to move his knees up under his body? So we could get him to do that. Again, we're just creating variations here, aren't we, in how we stimulate what's going on. Could I get him to go there and go side to side? And again, now we're working lateral flexion. Could I get him to create some kind of rotating kind of action? And in fact, often with patients, I give them this to go away and maybe do every morning. I call it a movement snack. Because if you do heavy loading, how often should you do that? It's a full meal, isn't it? You might need a few days of not eating, right? Whereas, can we also give people regular movement input? And I think sometimes people lack that. They lack basic regular input. Just to remind everything that it's okay to move. It's okay to be variable. It's okay.
I like the idea of calling it snacks because I'll give people nerve flossing exercises and just do it in bed, you know.
You can do that.
Before you get up.
Well, I think the reason why I thought about it like that is because snacking is a really, really good way to get too many calories, isn't it? We know that because you don't think about it. It becomes this subconscious thing where you don't really realise all the calories going in. So if we can do that with movement, is that going to create, without us noticing that much, more movement within our systems and our diets? But we also need to think about load and overload. Low load exercises are really, really good to do regularly. High load exercises you might do less regularly. Patients probably need both. They need something that might stimulate the system regularly, and they might need something that stimulates the system more, less regularly. So it's just thinking about the variables and how we use them. So a little routine that I give people, line your back for me, Jamie. A little routine that I play around with sometimes is I might get him to put his legs out. Again, it might be nice to be lying on the ground. What does that do for him? Likely to chill out a bit? Yeah, it just brings the system down. Sometimes I'll get people to play around with a bit of breathing, not because I know how they should breathe. I don't. Breathing again. What's the key to breathing?
It's not optional.
There's just do it, but variability is the key to breathing. If you want to go to sleep, what do you want your breathing to do? When you want to go for a run, what do you want your breathing to do? So it's heart rate, blood pressure, breathing. What do? They shift and change. Muscle function should probably shift and change as well. We know we are variable. What's the keys to biology? Variability and adaptability. We are organic beings, organisms. So another little cue that I use is hip hikes. Hip hikes, hip hitches, hip hikes, whatever you want to call them. What do you do when you hip hike your hip? Hippity hoppity hippity. What do you do when you hitch your hip? What happens to your lumbar spine? Side bends. Perfect. So again, the more you drive movement away from the body part, the more diffuse that movement becomes. So it's less aggressive, isn't it? So again, we can be less aggressive with loading and more aggressive with loading. What does that relate to? SIN, or sensitivity and irritability. C-signal. Fine, let's go with that. So again, I can give him a cue. One of the things I like